Both Governor Parson and local law enforcement agencies have insisted only local health departments have the authority to enforce social distancing guidelines. One local health agency says it is not that simple. KRCG 13's Gladys Bautista has checked into it. Gladys, you've learned it's a rather gray area.
That's right, Kermit. Today I spoke with Miller County's health administrator. Miller County is part of the Tri-County area where Lake of the Ozarks is. He tells me he can't enforce something that isn't law.
It's the local levels, the local health departments are the ones in charge of that.
Governor Parson making it clear Tuesday those are the entities able to enforce social distancing guidelines to prevent instances like this. A packed pool at Backwater Jack's Bar in Osage Beach over Memorial Day weekend. But Miller County's health administrator Mike Herbert tells me enforcement isn't that simple.
We don't have a local order now, so it's just a statewide order, and there's not a whole lot of clarity on how a statewide order gets enforced.
Herbert says Miller County's local order, which resulted in a misdemeanor if it wasn't followed, expired on April 30th, and statewide social distancing guidelines aren't laws. Though the bar at the center of the now viral video is in neighboring Camden County, it's far from a safe situation for anyone. The CDC says one of the most dangerous aspects of COVID-19 is that an estimated 35% of people with the virus don't show symptoms and may unknowingly be spreading it.
When I see the groups like that, it does concern me a little bit. We knew that throughout May that these tourism-driven businesses will become busier and busier, and by Memorial Weekend, most likely be at 100% capacity.
As of now, he explains there are no talks of enacting another local ordinance because Miller County has only 4 cases of COVID-19 to date, and all have recovered.
You won't see the results of Memorial Day weekend until probably 5 to 10 days down the road.
Missouri hospital administrators say recent layoffs are the result of canceling elective procedures to prepare for potential surges of coronavirus patients. Missouri Hospital Association officials say hospital revenues have fallen by half, which is about $32 million lost every day. MU healthcare officials announced earlier this month the elimination of more than 60 positions because of the COVID-19 pandemic. Doctors were not on the elimination list. MU healthcare officials expect more pay reductions, furloughs, and layoffs. MU Healthcare Chief Administrative Officer Michael Kohler sent KRCG a statement saying, "We are growing optimistic about the stability of our staffing going forward. We appreciate the responsiveness and understanding MU Healthcare and MU School of Medicine employees have shown during this difficult time, and we're grateful for their dedication to ensure high quality for our patients." BJC Healthcare manages Columbia's Boone Hospital Center. In a statement to KRCG, President and CEO Rich Leckwig says expense-saving measures include furloughs, a hiring freeze on non-patients facing positions, and delaying annual salary increases. Jefferson City's Capital Region Medical Center had about 90 employees on furlough during the pandemic. Spokeswoman Lindsay Human says clinic visits, elective and outpatient visits are beginning to rebound, and we have been able to bring about half of our furloughed staff back to work. St. Louis-based SSM Health owns St. Mary's Hospital in Jefferson City and St. Mary's Hospital Audrain in Mexico. SSM Health doctors began performing elective procedures earlier this month after canceling them in March to prevent the spread of COVID-19.
Kermit State Health Director Dr. Randall Williams said antigen testing is a new way to test to see if individuals have had COVID-19. Williams said he expects antigen testing will most likely be used for wide-scale screening because it's quick, easy, and inexpensive. Williams said it's a nasal swab test, but it's less accurate than a PCR test. Williams added he believes there have been cases in Missouri where people have tested positive, later tested negative, and then came back sick several days later. Williams says he doesn't think these cases necessarily are a reinfection.
We think it may not be. It may be that antigen in your lungs triggers some immune response so that even though your swab tested negative, that in your lungs, the antigen, the viral antigen is there, and you relapse as opposed to a true reinfection.